12-hour shift unless I was sitting on my own. Yeah, I feel that had a real detrimental effect to myself, and I know that there are even people within my family are suffering from it, regular sinusitis now, and that's what they, you know, I suppose having a mask on and having the fibres had an impact. My daughter's a nurse, her face would be red raw, literally, with wearing the mask all in a heated environment.
At paragraph 63, you talk about your attitude to the vaccine. I'll give you the opportunity to explain that.
Yeah. I do believe I have long COVID. And whether, I mean, I'm not a microbiologist, haven't studied it in depth, but I do know, and I do feel that the vaccine came out so quickly. And although, of course, there are, you know, they've done various studies prior to it, you know, COVID-19, on the one hand, they were saying it's so unique, it's so different from other, you know, virus. To think that in jig time they could have managed to get a vaccine that was somehow going to have that impact, you know, to prevent you having it or for it to be less of an impact. I don't know, I'm very, very sceptical about it. I know people who have not had the vaccine and have had COVID and it's been slight and they've suffered, you know, they've had conditions like diabetes or whatever. I know people have had all the vaccines and have had COVID, which has hit them like a ton of bricks. Who knows? I certainly, as I said, I took 2 vaccines. I wish I had never taken it at all. And if I was offered it again, I wouldn't do it. I think there was an awful lot of pressure. Although I don't believe it was mandatory, certainly there was that feeling of, you'll be taking the vaccine, well, you'll not be going here and you'll not be going there and you'll not be flying. There could be an element of you losing your job. All of this was an undercurrent going on.
That was the next.
It's kind of veiled threats towards what will happen if you don't take the vaccine.
That was the next thing I was going to ask you about, because you make reference to that at paragraph 66. And I think I don't need to ask you to repeat what's in paragraph 66. Those are all the questions I have for you, unless there's anything important that you think I haven't covered. Ms Napier, thank you very much.
Thank you.
Yes.
My Lord.
Thank you, Ms Napier. Very good, and thank you, Ms Caskey. Now, Ms Caskey, we finished early again, which is, this is not a criticism, relatively common. I don't know if the next witness is here, actually.